And you are welcome. We have health, and joining us right now is, someone who's going to be talking about living with asthma and its impact on the family, not just the individual. We have Dr. Omolabake Okunubi, a.k.a. Dr. LBK. She's a certified physician and also asthma advocate with over 16 years medical experience. You are welcome, Dr. LBK.
Thank you very much for having me.
It's good to have you here. Now, asthma is something a lot of people live with, and a lot of families live with people who live with it.
Absolutely.
I've had friends, or have friends, who currently live with asthma, and I also note how it affects the entire family. But that's what we're here to talk about today. You're going to shed more light on that. Why is it relevant to discuss how it affects the family?
Thank you very much. I think it's sad, of course, like you rightly said, that people still die from asthma. Before I even go into that, maybe I should just even do a little bit of introduction on what asthma really is. Asthma is the disease of the airway, all right? And when we talk about the airway, I'm going to put it as basic and as simple as possible. The airway is like a tube, okay? You have, of course, from the nose and the mouth, then you have that tube that connects to the lungs. Okay, yeah, the trachea, and then you have the bronchi, and then you have the lungs.
Yeah, biologist, by the way.
Yes, so fantastic. And so what happens with asthma patients is that, of course, people that are susceptible to asthma would have some things that would have gone on. I don't want to go into that ab initio, okay? And so when they come in contact with what we call their triggers, the things that, instigate this asthma, so to say, the airway, I usually would like to use a tube to demonstrate what the bronchi really is. It's just like a tube, like your straw. So imagine, you're trying to get a drink from using a straw, and the straw gets kinked. Yeah. You can't get out the fluid, and you can't get into that drink. So that's exactly what happens in the airway. Yeah. So you have it kinked. There's inflammation. Of course, that's also a very important thing. Inflammation is like a swelling that, as a result of some chemical things that would have occurred in the patient's system, okay? And so you have that swelling, you have that collapse, and all of that going in that tube. So you can imagine that means that air can go in. I mean, a lot of times I usually would say a lot of people should just try and see how long you can hold your breath for.
For it to relax.
Yeah. No, you wouldn't even open up until you have to put some things in place. Now, that's in summary what happens in the airway of an asthma patient. The tube, this tube we're talking about, is totally blocked, and you can't get air in or out, however it is. And you can imagine that, when you bring that back home in terms of family, all right, how does it affect the family? The burden of asthma is enormous. I mean, there's so many things not even quantifiable. First of all, let's look at the people, the sufferers, whether a child or an adult. Okay, we're talking about school earlier. So a child that has asthma, obviously, there's absenteeism. The child can't get to go to school as often as he should. Even when the child is in school, we're talking about patients that are not controlled now, all right? Even when the child is in school, because the child has had symptoms during the night, couldn't coughing and all that, didn't sleep well. So the child gets to sleep in school. Even an adult, imagine if you had asthma and you had the symptoms, you'd be tired during the day, non-productive. Imagine a wife, a lady is cooking right here. If she was an asthma patient in the house, she can't cook some of this food that she's cooking because,
trigger.
Exactly. So that's brings some of the burden back into the family. The anxiety, I don't know if you've ever seen a patient that has an acute exacerbation, that has an attack, what we call an attack. It's scary. So imagine as a mother, you're trying to sleep, or a father or siblings, and knowing that your younger brother or your parents, somebody has asthma, you're not even able to sleep well. The anxiety, and then, of course, the cost of having to come to the hospital every time. Maybe, we know what the economy is like now. So imagine the little fund that you're supposed to use in taking care of needs at home. You have to expend it on emergency, going to the hospital and all of that.
So what must families have in mind when they are in this situation?
So I think, first of all, family needs to accept, understand the disease entity, understand what the disease is, okay? And understand that asthma has moved from what it used to be years ago, where, people believe asthma is a death sentence, all right? It's moved beyond that. In the next couple of weeks, we'll be talking about more things and how to support patient that have asthma. But accepting it, understanding it is the first thing, first step. Knowing that, you know, the fact that my child or my son, my husband, my wife has asthma, it doesn't mean it's a death sentence. It doesn't mean there's something the child has done wrong. It doesn't mean, I mean, like we always say in our own parlance, why me? You know, there's so many things that can be done to ensure that that child or that patient or that sibling or brother can live life normally. Okay, we have so many people.
It would also behoove these families to also make sure that the environment is suitable for their siblings or sons or daughters who suffer.
Yes, absolutely. And so understanding it, getting education on the disease entity, knowing that what we call triggers, like for instance, if your trigger is like dust mites, ensuring that, you know, you don't have some certain things in the house, carpets.
Exactly. I have a friend who's got no carpets at home.
Yes, carpets.
Absolutely forbids it.
If it's pets, you know, pets and all, you know, cats and all of those things, and generally just understanding maybe the air conditioning, always ensuring that it's properly cleaned, and you know, helping this sufferer identify their triggers. Okay, is also very important, as that would help you move them away from their triggers, aside the pharmacotherapy, in terms of aside the medication that they would use. Avoidance of trigger is also very important. But by and large, of course, it brings us to education, the family understanding it, supporting this patient, not stigmatizing them. You know, that's even beyond family. Sometimes you have the stigma coming from members of the public.
So I was going to go there. I was going to say all these education and talk we're talking now is based on how families can help and understand and also support these individuals. But what about workplaces? Are we ever going to talk about that? Have you had instances where you had to advocate for better work conditions in workplaces for people who live with asthma?
Yes, absolutely. But of course, there's a limit to how much you can advocate in that area, because you have people that, for instance, I had a patient years ago that just started working in an oil environment, oil company, and does some, maybe where he works or the environment where he was working, obviously developed this symptom that seemed funny from nowhere. But at the end of the day, we found out that it was as a result of the triggers were actually right there at work. Now, this is somebody that is earning so much money from that company. And, you know, the most you can do is to try and talk to the employer to say, look, can you at least perhaps move this patient to another location, because the trigger, even with the medication, the trigger was within the workplace. But I guess continuation education, you know, continue education about this in terms of even schools. I mean, workplace, the government, the role of everybody in trying to ensure that we do our own bits to see that, you know, wherever patient that have asthma, it's sort of safe for them, you know, to work.
Well, Dr. LBK, it is fantastic having you here, and I'm sure that we're going to be having a series of this throughout the entire month of May. So we're looking forward to these other aspects of dealing with or supporting people who live with asthma. Come next week, you'll be here again.
Absolutely.
Do make sure that you're joining us then, because it's going to be a very interesting conversation and also a learning period for everybody who's either living with or suffering with such an instance or living with people who are.